Hello guys, and welcome to this video specially made for those that are still not feeling safe to diagnose caries or else feeling not safe to make the treatment plan. So what would you do to treat those caries? Would you restore? Would you place a sealant or something? So what to do exactly? And that's why we are making those videos to orient you guys on those decisions. Don't forget that we have this checklist here. So those are main questions that you guys need to ask every time that you are diagnosing caries clinically and radiographically. To analyze those questions, we are going to review clinical cases like this one with clinical and radiographic images for you guys to compare to see the situation in the clinical, in the intraoral image, and then in the radiographs so that you guys can compare and learn a little bit better. First, we need to check if it's occlusal or interproximal caries, because occlusal caries, the gold standard diagnosis is the clinical diagnosis, not the radiographic diagnosis, okay? The interproximal caries, then yes, radiographic diagnosis is the gold standard. Then we are going to see it's initial or severe. So initial means only up to the enamel or the dentin is also affected, and now we need to restore, okay? Now we need to restore because the dentin is now affected by these caries. Is it active or arrested? There is a video also only about this difference between active or arrested caries. Active are the soft caries, of course. I'm going to place the link of this video here on the top right corner of this screen. There is an entire playlist. I will also add the link of the playlist here for you guys of caries. Okay, so if you guys go through this playlist and watch all the videos, keep the audio open while you guys are studying or doing something else, you guys will learn, or watch them properly, of course, which is better. You guys will learn caries diagnosis and management properly, okay? So give you this time of study because this playlist was specially made for you guys. It's available on the website of the YouTube channel. The other question is root canal treatment needed or not? So endodontic treatment is needed or not? Because this will change your treatment plan as well. Now, take a look at this case. You guys are seeing interproximal caries between the premolars. Okay, let's focus on the upper arch now. So between the premolars, we have interproximal caries. There is even a shadow of the first molar, but this is not conclusive yet. I will explain why very soon. And then we have these restorations. We have staining of these restorations. But again, we first need to see if there are caries using the ball tip probe, the ICDAS classification, in your clinical intraoral exam. Now I will highlight a situation here for you guys. Take a look, I will highlight in red this situation over here. If it's confirmed that it's caries with the ball tip, so the ball tip gets stuck because it's a cavity, then you guys will consider that there is caries in this case, and then you use the radiograph to see the extension of these caries, okay? So that's how we do to plan the treatment of caries. If you guys didn't understand this, go back this part of the video because that's very important, okay? So the radiograph will see the extension, but only when the ball tip probe confirms that there are cavities, there is a cavity. Now, this situation here, there is an interruption of the enamel on the radiograph, but this was not still a cavity, so this was not confirmed as caries in the clinical intraoral examination, okay? So it was not caries actually, right? Only to complete the analysis of this case, the two restorations of the lower arch are two class 5 big restorations, surprisingly, of the two molars, right? Superimposed to the pulp chamber and even to the cervical areas of these teeth. Now, is this bite-wing correct? Is this a good bite-wing radiograph? So we don't say x-rays, we say radiographs. Well, not really, because we have a lot of superimpositions, okay, of the interproximal surfaces. The mesial of one tooth is in front or behind, so it's superimposed to the distal of the adjacent tooth, and that's not ideal. Why this is happening? Because we are not completely parallel to the mesial and distal surfaces of the teeth, right? So make sure that you have the correct directions when you do your bite-wing radiographs. So let's see the other side of this case now. And again, we have restorations, staining of the restorations. I don't believe, I will highlight in red as well, I don't believe that the intraoral scanner scanned all this area properly of the second molar. But again, if there is no ball tip probe getting stuck in a cavity, then it's not caries, and this was still not caries, okay? Although we see a radiolucent aspect below the enamel, but this is all around the molar, actually, if you follow the contours. So maybe this is the superimposition of another cusp or another, don't forget that this is 2D radiographs. Of course, you guys realize that instead of clinical images, we are showing intraoral scans because, of course, that's the digital impression of a patient, and that's even the intraoral scans can be used to detect caries. There is already research on that, but there's also the fluorescence images like this one. I'm going to show the one of this case now to you guys. And of course, this is a tool still under research, but you can use as an additional tool, okay, not replacing the gold standard methods, but at least as an additional tool for you to see the features that you have higher risks, or even the places that you have the caries, okay? So it's something that will help you in your treatment plan. All right, so then we are seeing the features that we have staining here on this case, but let's see other cases for you guys to understand soft caries, for example. Let's see a case of soft caries, and there you have it. Take a look at this aspect. So this is an aspect of soft caries, of course, so a very young patient, and then we can confirm that we have those caries. We're talking about the upper arch, of course, and this is the upper caries, okay? The hard palate was not scanned, but we have even these caries over here, okay? Of the ones in dark red belongs to the mesial tooth. And now, yes, now that the clinical examination confirmed caries, then you check the extension of these caries on the radiographs and take a look at this. They are actually deep. They are maybe not yet very close to the pulp chambers, but they are deep. And there is even caries on the lower molars, especially the permanent one. Let's see now other cases here, and even of course, the caries detection of the intraoral scanner. But again, we already confirmed it in the clinical examination, so that's just an additional tool you could use to show to the patient, because it's an image of diagnosis. So, all right, it's just something, an additional data that you are using now. Although research can be finding new findings, of course, so depends on when you are watching this video. Maybe we already have new results, new tools of fluorescence methods of intraoral scanners, right? Now let's see what's going on here. We have this upper teeth first, then, and again we have the fissures stained, but is this caries? Well, we need to check the clinical examination to make sure that this is caries, okay? Otherwise, you cannot consider, by the radiographs, you cannot consider caries for sure, all right? So that's something really important for you guys to learn. But then on the lower situation of the same biting radiographs, then of course you guys realize that we have caries, of course, with involvement of the pulp chamber. So this will lead to endo. Of course, that's dependent on the treatment plan. This is a deciduous tooth, of course, and then you have even interproximal caries on the other side, on the distal side, but we already know that the pulp chamber is involved on this lesion, right? And in the intraoral scans, you guys are seeing the dark red image because it's the areas that are darker, almost black within this area, are deeper areas. That's why you guys are seeing like this, right? Regarding the permanent molar, you guys are seeing the last tooth here, the distal tooth. You guys are seeing that there are some fissures, even class 5 caries were detected, but the radiograph is not contributing a lot for this diagnosis, right? Again, class 5, class 1 caries for you to detect in the clinical examination first, okay? Interproximal caries, yes. Then, so class 2, for example, that starts with the detection of interproximal caries, then yes, then the gold standard will be the radiographs, okay? Very good. So now let's see another situation here. So we have the occlusal caries of this molar, and then again, in this case, we are seeing now the extension of these caries Even though the interruption of the enamel is not so clear on the radiographs, we are seeing, again, a very young patient, we are seeing the extension of this caries, and now it's even close to the horn of the pulp chamber, okay? So we need to be careful about that. So you are going to use both clinical and radiographic examination to plan the treatment of these caries. So pediatric patients, you plan the case maybe in a different way, but of course you will proceed with the proper treatment plan and choosing the proper material for each situation for you to restore a case like this. And then, of course, considering that endodontic treatment is not needed. Otherwise, you are going to proceed first with all the removal of caries, endodontic treatments, and then your restoration. Okay? So just a quick review of cases for you guys to be always updated regarding caries diagnosis and treatment plan and management. So if you guys like, please hit the like button and see you guys on the next videos.